I'm Dr. Ryan Stanton with the American College of Emergency Physicians and some safety tips. First and foremost, this is a time of gift giving, and that means the potential for choking hazards and dangers associated with the toys we're getting for the kids. First, make sure that you're getting age-appropriate toys. There's a reason those ages are on there, because sometimes the pieces are small. Kids like to experiment by putting things in their mouth, and that can cause a choking hazard. So be very careful. Now, one of the biggest risks we see as emergency physicians is the risks of magnets and button batteries. So especially when you're getting those toys together and ready and checking what Santa has hauled in, make sure that you're careful with button batteries or any type of magnets. These can be very dangerous for children, causing permanent damage and can be life-threatening if not caught in a timely fashion. So take a few moments, make sure that you're safe, and let's keep the kids safe for a happy holiday season. I'm Dr. Ryan Stanton with the American College of Emergency Physicians with some more holiday safety. Every single year, emergency physicians see thousands of individuals who come in secondary to injuries from either putting up or taking down the decorations. There's a few things that you can do to help keep yourself safe. First and foremost, if you're not used to getting up a ladder, don't do it. Hire somebody else to do it. We see a ton of people coming in secondary to getting dizzy or falling or unsteady on top of a ladder. This is especially true if you're up there in age and mileage, when your ears may not necessarily help you with that balance. Also, if you're using a ladder, make sure that you have it on steady ground. This time of year, between the rain, snow, and weather, we tend to see a lot of unsteady ground in places where ladders can settle, causing falls. And finally, make sure that you're taking care around any type of sharp objects or plants or porches or railings. These are common areas where we tend to see a lot of injuries associated. And to wrap it up, if you have winter weather around, be careful with the potential of slips and falls. That ice can sneak up on you, but I guarantee you, gravity is undefeated. Take a few moments, be safe, and have a wonderful holiday season. I'm Dr. Ryan Stanton from the American College of Emergency Physicians. And one of the biggest things we see this time of year is the winter weather-related injuries. Whether it's the slips and falls, interestingly, it's not the first day of the snowstorm that gets us. Everybody stays inside and drinking their hot cocoa or whatever we do to stay safe. But it's really the following days where people start to get out and about again. We start to see a lot of slips and falls, especially among the elderly. And the biggest risk and concern is those that have either osteoporosis and or on chronic anticoagulation therapy. Those can be very dangerous. So you want to make sure that you're safe, that you're wearing proper footwear, that you've cleared off your steps, your sidewalks, your driveway. And honestly, if you're high risk, let somebody else check the mail and for packages, because that is high risk and we see it all the time, especially slips and falls on ice on the stairs. I can tell you right now, gravity's undefeated, it will win. Other things we see are the snow clearing related injuries. Shoveling snow is actually one of the most impressive stress tests that people go through. The cardiac stress test you see in the hospital, this is one in the wild, and unfortunately many people fail it. In fact, about 100 people every year in the United States die from snow-related or clearing-related heart attacks. Also, if you're in an area where you use those snow blowers and cleaners and things like that, be very careful with those. Those moving blades and the necessary spin and RPMs to clear the snow can be quite dangerous, so never clear out a blockage with your hands. If you've seen that scene from Fargo talking about the wood chipper, metal and the human hand do not go together. So be very careful, because that can be dangerous and cause permanent disability, because even with the best plastic and hand surgeons, you may not get it all back together. Take a few minutes, be safe, because the snow is falling, the ice is around, and it can cause significant injuries. And I honestly don't want you to have to see one of us in the emergency department with winter-related injuries. I'm Dr. Ryan Stanton from the American College of Emergency Physicians, and in some areas of the country, it's getting downright frigid outside. With cold weather comes the increased risk of cold-related injuries. And it really doesn't mean that you have to be in northern latitudes to have cold-related injuries. We see them all across the country, just based on areas that aren't accustomed to such drops in temperature. So it really doesn't matter where you are, there's still the potential for ice and cold-related injuries. First and foremost, especially if you're getting wet, if there's rain or cold weather, that significantly increases that heat dissipation and can cause hypothermia much more quickly. The most common question I get when we're talking about how long does it take for hypothermia or frostbite to set in It all depends. There's a lot of things that go into it. It's the moisture, it's the temperature, it's the wind, it's your risk factors, it's the clothing. There's so many different things, and it can happen in minutes or it can take hours. Either way, the risk is there. With regard to hypothermia, there's a lot of things: dressing in layers, staying as dry as possible. The moisture, once again, wicks away that heat much more efficiently than dry clothing. So making sure that you're replacing socks, that you're replacing undershirts, that you have multiple layers to keep it in, just like the insulation on the house. With regard to frostbite and hypothermia, of those areas that are exposed, making sure that you keep them covered. The most common and high-risk areas are those fingers, toes, nose, and ears. They're the highest risk just because of the surface area compared to the blood supply. With regard to potential frostbite and frost nip, keeping them covered, getting them warmed up as quickly as possible, and honestly, if you have any concerns, getting help and getting it checked out. I'm Dr. Ryan Stanton with the American College of Emergency Physicians. During the holiday season, millions of Americans will head over the river and through the woods to grandma's house or wherever you're going to visit family, friends, or whatever holiday travel you have in store. The key here is to keep it safe. Make sure that you're obeying traffic laws, wearing your seatbelt at all times, making sure that everybody in the car is appropriately restrained, especially children with the age-appropriate seatbelt. Make sure that people have their feet on the ground and sitting up properly. Putting your legs up in the air or slouching down will increase that risk, because honestly, the seatbelts and seat and car design are not designed for that with regard to safety, especially when we're dealing with potential airbags that are going to be deployed in a car accident, which can save your life, but can cause injuries if not used or not in the car appropriately. Make sure that you're ready to go, especially if you're going to be in cold weather, snowy or icy weather, that you have stuff in the car and have clothing and dress in a way that you can be prepared to be out in the elements for hours, if not longer. We see a lot of times these backups on the interstate in areas and snowy areas that can cause significant risk to life and limb simply from being somewhere that you didn't expect to be for an extended amount of time. And finally, pack your patience. There's a lot of people out there, whether it's in the air or on the road. There's millions out there with you. Being patient is a great way to prevent the holiday frustrations and stress that may prevent you having a great holiday season. Be safe and have a wonderful Christmas and holidays.